Question 1. A social worker is meeting with a client who has recently started a new antidepressant medication. The client reports feeling restless, agitated, and is experiencing difficulty sleeping. What is the social worker's first action? A. Advise the client to stop taking the medication immediately. B. Suggest the client try an over-the-counter sleep aid. C. Document the client's symptoms and encourage them to contact their prescribing physician. D. Provide the client with information about alternative herbal remedies. Answer: C. Document the client's symptoms and encourage them to contact their prescribing physician. This question addresses the social worker's ethical and professional boundaries concerning medication management. The keyword first emphasizes the initial and most appropriate professional response. Social workers are not medical professionals and cannot advise on medication changes or alternative treatments. Their role is to facilitate communication with the prescribing doctor when adverse effects or concerns arise. For instance, if a client describes a new rash after starting medication, the social worker would also direct them to their doctor. Always remember that any medication-related concerns should be immediately referred back to the prescribing medical professional. Question 2. A social worker is preparing for an initial home visit with a client who has a history of opioid use disorder and lives with their young child. What is the social worker's most important consideration for this visit? A. Ensuring the client has access to local food banks. B. Assessing the child's developmental milestones. C. Evaluating the safety of the home environment for the child. D. Discussing potential vocational training programs for the client. Answer: C. Evaluating the safety of the home environment for the child. This question centers on the social worker's responsibility for client and family safety, especially involving vulnerable populations. The phrase, most important consideration, directs attention to the paramount concern. When a child is present in a home where a parent has a history of substance use, ensuring the child's immediate physical and emotional safety is always the highest priority. For example, checking for safe storage of medications or substances, and the overall cleanliness and supervision, are crucial. Always prioritize the safety and well-being of any children or vulnerable individuals in the household above all other concerns. Question 3. A client diagnosed with bipolar I disorder has been prescribed lithium and reports consistent nausea and a slight tremor. What is the social worker's next step? A. Recommend the client switch to a different mood stabilizer. B. Educate the client about the importance of consistent medication adherence. C. Advise the client to increase their fluid intake. D. Encourage the client to report these side effects to their psychiatrist for assessment. Answer: D. Encourage the client to report these side effects to their psychiatrist for assessment. This question tests the social worker's understanding of their role in monitoring clients on psychiatric medications. The keyword next guides the social worker to the appropriate immediate action. Nausea and tremor can be common side effects of lithium, and while some side effects might be managed, new or worsening symptoms, especially with narrow therapeutic index drugs like lithium, always warrant medical evaluation by the prescribing physician to rule out toxicity or adjust dosage. For instance, if a client on an antipsychotic reported sudden muscle stiffness, the social worker would similarly advise contacting the prescriber. Always refer medication side effects or concerns back to the prescribing physician for proper medical assessment and management. Question 4. A social worker is facilitating a support group for individuals with anxiety disorders. One group member states they stopped taking their prescribed benzodiazepine cold turkey because they didn't like how it made them feel. What is the social worker's best response? A. Remind the client of the importance of adhering to medication as prescribed. B. Ask the client to share more about their feelings to the group. C. Explain the potential dangers and withdrawal symptoms associated with abruptly stopping benzodiazepines and advise them to contact their doctor immediately. D. Refer the client to a therapist who specializes in medication management. Answer: C. Explain the potential dangers and withdrawal symptoms associated with abruptly stopping benzodiazepines and advise them to contact their doctor immediately. This question evaluates the social worker's responsibility to address immediate safety concerns related to medication. The keyword best points to the most urgent and protective action. Abruptly stopping benzodiazepines can lead to severe and potentially life-threatening withdrawal symptoms, so it is critical for the social worker to inform the client of this risk and ensure immediate medical consultation. For example, withdrawal can include seizures, which are a serious medical emergency. Always prioritize the client's physical safety by providing essential psychoeducation on the dangers of abrupt medication cessation and directing them to medical care. Question 5. A social worker receives a referral for a 16-year-old client diagnosed with ADHD, who is prescribed a stimulant medication. The client's parents express concerns about their child's recent weight loss and decreased appetite. What is the social worker's most appropriate initial action? A. Suggest the parents change the child's diet to include more calorie-dense foods. B. Educate the parents about typical side effects of stimulant medications for ADHD. C. Encourage the parents to schedule an appointment with the prescribing physician to discuss their concerns. D. Recommend the parents monitor the child's food intake more closely for a week. Answer: C. Encourage the parents to schedule an appointment with the prescribing physician to discuss their concerns. This question assesses the social worker's role in addressing medication side effects in a minor. The phrase, most appropriate initial action, requires identifying the correct first step when medication side effects are reported. Weight loss and decreased appetite are common but significant side effects of stimulant medications, which warrant medical review and potential dosage adjustment by the prescribing physician, rather than dietary changes or prolonged monitoring alone. For instance, a doctor might suggest timing medication around meals. Always direct clients or their guardians to the prescribing doctor when concerning medication side effects, especially in children, are observed. Question 6. A social worker is conducting a biopsychosocial assessment with a new client who reports experiencing panic attacks. The client states, "I just want a pill to make these go away." What is the social worker's best response? A. Explain that medication can be helpful for panic attacks and offer to refer them to a psychiatrist. B. Advise the client that medication is often overprescribed and suggest therapy instead. C. Explore the client's understanding of panic attacks and their feelings about different treatment options. D. Focus the assessment on the client's past trauma as the likely cause of the panic attacks. Answer: C. Explore the client's understanding of panic attacks and their feelings about different treatment options. This question tests the social worker's ability to engage in client-centered practice regarding treatment preferences. The keyword best indicates the most therapeutic and empowering approach. Before making any referrals or offering opinions, it is crucial to understand the client's perspective, their knowledge about their condition, and their hopes and concerns regarding various interventions, including medication and therapy. For example, asking, "What have you heard about treatments for panic attacks?" can open a dialogue. Always start by exploring the client's perspective and understanding of their condition and treatment options to ensure client-centered care. Question 7. A client with a history of alcohol use disorder who is currently sober is prescribed naltrexone. The client calls the social worker, stating they missed 2 doses because they felt fine. What is the social worker's next action? A. Remind the client that naltrexone helps reduce cravings and the risk of relapse. B. Advise the client to resume taking the medication as prescribed immediately. C. Explore the client's reasons for missing the doses and potential barriers to adherence. D. Suggest the client consider a different medication for alcohol use disorder. Answer: C. Explore the client's reasons for missing the doses and potential barriers to adherence. This question focuses on adherence and motivational interviewing in medication management. The keyword next guides the social worker to an intervention that promotes understanding and client engagement. Rather than simply instructing or reminding, exploring the client's reasons for non-adherence allows the social worker to identify underlying issues, address concerns, and collaboratively develop strategies to improve adherence. For example, asking, "What got in the way of taking your medication?" opens a non-judgmental dialogue. Always seek to understand the client's perspective and the challenges they face regarding medication adherence before offering solutions. Question 8. A social worker is conducting an intake assessment with an elderly client who lives alone and reports taking multiple prescription medications. The client mentions sometimes forgetting to take their evening dose. What is the social worker's best recommendation? A. Suggest the client use a weekly pill organizer. B. Advise the client to set an alarm on their phone as a reminder. C. Explore the client's daily routine and discuss strategies to integrate medication taking. D. Encourage the client to ask a family member to call and remind them. Answer: C. Explore the client's daily routine and discuss strategies to integrate medication taking. This question tests the social worker's ability to provide client-centered and practical solutions for medication adherence. The keyword best indicates the most holistic and effective approach. While pill organizers or alarms can be helpful, exploring the client's routine allows for personalized, sustainable strategies that fit their lifestyle, addressing underlying reasons for forgetting rather than just providing a tool. For example, connecting medication time to an existing daily habit like brushing teeth can be very effective. Always tailor adherence strategies to the individual client's lifestyle and preferences for maximum effectiveness. Question 9. A client receiving services for depression reports feeling significantly better after starting a new antidepressant. They express a desire to stop therapy because the medication has fixed everything. What is the social worker's most appropriate response? A. Support the client's decision, acknowledging their improvement. B. Explain that medication often works best in conjunction with therapy and explore their reasons for wanting to stop. C. Advise the client that stopping therapy prematurely could lead to a relapse. D. Refer the client back to their psychiatrist to discuss discontinuing therapy. Answer: B. Explain that medication often works best in conjunction with therapy and explore their reasons for wanting to stop. This question assesses the social worker's role in psychoeducation and client engagement regarding combined treatment. The phrase "most appropriate response" indicates a need for a balanced and informed approach. While acknowledging improvement, it's crucial to educate clients that medication often manages symptoms, while therapy addresses underlying issues and coping skills, and that both are typically more effective together. For example, medication might lift the fog, but therapy teaches how to navigate the path. Always engage the client in a collaborative discussion about the benefits of continued treatment, addressing their perspective rather than simply dictating a course of action. Question 10. A social worker is reviewing a client's medical history and notes a prescription for an antipsychotic medication. The client has no documented psychiatric diagnosis. What is the social worker's first action? A. Assume the medication is for an undiagnosed mental health condition. B. Educate the client about the common side effects of antipsychotics. C. Ask the client about the purpose of the medication and who prescribed it. D. Contact the client's primary care physician for clarification. Answer: C. Ask the client about the purpose of the medication and who prescribed it. This question highlights the importance of information gathering and respecting client autonomy in medication management. The keyword first emphasizes the initial and direct approach. Before consulting other professionals, the social worker should always start by asking the client directly about their own medications and their understanding of why they are prescribed, as this is a fundamental part of a thorough assessment and client empowerment. For instance, a client might be taking an antipsychotic for a non-psychiatric condition like nausea or hiccups. Always gather information directly from the client first to understand their perspective and situation before seeking external information. Question 11. A social worker is facilitating a psychoeducation group for clients newly diagnosed with generalized anxiety disorder. When discussing treatment options, a client asks if they should take medication. What is the social worker's best response? A. Provide a general overview of anti-anxiety medications and their common side effects. B. State that medication is a personal choice and encourage them to research options online. C. Explain that medication can be an effective treatment and encourage them to discuss it with their doctor. D. Emphasize that therapy is usually more effective than medication for anxiety. Answer: C. Explain that medication can be an effective treatment and encourage them to discuss it with their doctor. This question tests the social worker's role in providing balanced psychoeducation while maintaining professional boundaries regarding medical advice. The keyword best points to the most appropriate and ethical response. Social workers can educate about treatment options generally, but they must always refer clients to their medical doctors for specific medication advice, as medication decisions are medical in nature. For example, a social worker might explain that SSRIs are often prescribed for anxiety, but the doctor will determine if it's right for them. Always empower clients to make informed decisions by directing them to the appropriate medical professionals for medication-specific guidance. Question 12. A client receiving services for depression and anxiety is prescribed a selective serotonin reuptake inhibitor, SSRI. After several weeks, the client reports feeling more energetic but now experiences persistent insomnia. What is the social worker's next step? A. Advise the client that insomnia is a common side effect and may subside. B. Suggest the client take their medication in the morning instead of at night. C. Encourage the client to discuss the insomnia with their prescribing physician. D. Recommend relaxation techniques to help manage the insomnia. Answer: C. Encourage the client to discuss the insomnia with their prescribing physician. This question focuses on the social worker's responsibility when a client experiences a new or persistent medication side effect. The keyword next indicates the immediate appropriate action. While relaxation techniques might offer some relief, persistent insomnia after starting an SSRI is a side effect that needs to be assessed by the prescribing physician, who can determine if a dosage adjustment, timing change, or alternative medication is necessary. For example, some SSRIs are more activating than others. Always direct clients experiencing medication side effects to their prescribing doctor for medical evaluation and management. Question 13. A social worker is conducting a risk assessment with a client experiencing severe depression. The client mentions having access to a firearm in their home. What is the social worker's immediate priority? A. Explore the client's history of firearm use. B. Develop a safety plan that includes securing or removing the firearm. C. Educate the client about the risks of having a firearm while depressed. D. Refer the client for immediate psychiatric hospitalization. Answer: B. Develop a safety plan that includes securing or removing the firearm. This question addresses crisis intervention and immediate safety planning. The phrase immediate priority highlights the urgent need to mitigate direct threats. When a client with severe depression, especially with suicidal ideation risk, has access to lethal means like a firearm, the most critical and immediate step is to create a safety plan that reduces or eliminates access to those means. For example, discussing storing the gun with a trusted family member or securing it in a locked safe are vital steps. Always prioritize reducing access to lethal means when assessing risk of harm to self. Question 14. A client, who is prescribed an antipsychotic medication, informs the social worker that they have been taking extra doses because they feel it helps them think clearer. What is the social worker's best response? A. Remind the client that taking extra doses is dangerous and tell them to stop. B. Explore the client's understanding of their medication and their reasons for altering the dosage. C. Immediately contact the prescribing psychiatrist to report non-adherence. D. Educate the client about the potential for overdose and adverse effects. Answer: B. Explore the client's understanding of their medication and their reasons for altering the dosage. This question emphasizes a client-centered approach to medication non-adherence. The keyword best directs the social worker to an intervention that promotes understanding and collaboration. Before acting, it's essential to understand the client's motivation for altering their medication, as there might be a legitimate belief or misunderstanding guiding their actions. For instance, they might genuinely feel clearer, or they might be misinterpreting their symptoms. Always seek to understand the client's perspective and reasons for their actions regarding medication before intervening or reporting. Question 15. A social worker is working with a client who is prescribed an anxiolytic medication for generalized anxiety. The client reports that the medication makes them feel too drowsy to function effectively during the day. What is the social worker's best initial action? A. Suggest the client take a nap when they feel drowsy. B. Encourage the client to discuss the side effect with their prescribing physician. C. Advise the client to try taking half a dose to reduce drowsiness. D. Recommend switching to a different anxiolytic that causes less drowsiness. Answer: B. Encourage the client to discuss the side effect with their prescribing physician. This question tests the social worker's appropriate response to medication side effects that impact a client's daily functioning. The keyword best initial action emphasizes the professional and ethical first step. Drowsiness from anxiolytics can significantly impair a client's ability to function, and while concerning, it is a medical issue that requires the prescribing physician's assessment and potential medication adjustment. For example, the doctor might suggest a different medication or a change in dosing schedule. Always direct clients experiencing bothersome medication side effects to their prescribing doctor for evaluation and management. Question 16. A social worker receives an urgent call from a client who states they accidentally took a double dose of their antidepressant medication. What is the social worker's first recommendation? A. Advise the client to call their prescribing physician immediately. B. Tell the client to drink plenty of water and rest. C. Instruct the client to take an activated charcoal supplement. D. Call emergency services on behalf of the client. Answer: A. Advise the client to call their prescribing physician immediately. This question highlights the social worker's role in addressing potential medication overdose or errors. The keyword first indicates the most appropriate and direct course of action. While some accidental double doses might not be immediately life-threatening, any medication error, especially with psychiatric medications, warrants immediate medical advice from the prescribing doctor, who can assess the risk and provide specific guidance. For instance, the doctor might instruct the client to go to the emergency room or monitor for specific symptoms. Always direct clients to medical professionals for immediate guidance following a medication error. Question 17. A social worker is conducting a family meeting with parents of a child recently diagnosed with ADHD, who are hesitant about starting stimulant medication due to concerns about side effects. What is the social worker's best approach? A. Present research demonstrating the efficacy of stimulant medication for ADHD. B. Reassure the parents that stimulant medications are generally safe. C. Validate their concerns, provide general information about ADHD treatment options, and encourage discussion with their pediatrician or child psychiatrist. D. Focus on behavioral interventions as a preferred alternative to medication. Answer: C. Validate their concerns, provide general information about ADHD treatment options, and encourage discussion with their pediatrician or child psychiatrist. This question focuses on client education, validation, and professional boundaries in the context of medication decisions for a child. The keyword best indicates the most supportive and ethical approach. It is crucial to validate parents' concerns, offer balanced information about various treatment modalities, medication and behavioral interventions, and empower them to make informed decisions by referring them to medical professionals for specific medication advice. For example, a social worker might explain that both medication and therapy are often used, and their doctor can discuss the pros and cons. Always validate client concerns and facilitate informed decision-making by directing them to the appropriate medical experts for medication-specific questions. Question 18. A social worker is working with a client who has schizophrenia and is prescribed a second-generation antipsychotic. The client expresses concern about experiencing significant weight gain since starting the medication. What is the social worker's next step? A. Educate the client about healthy diet and exercise. B. Encourage the client to discuss their concerns with their psychiatrist. C. Advise the client that weight gain is a common side effect and to accept it. D. Refer the client to a nutritionist for a weight management plan. Answer: B. Encourage the client to discuss their concerns with their psychiatrist. This question assesses the social worker's role in addressing a client's concerns about medication side effects that impact their quality of life. The keyword next guides the social worker to the appropriate professional action. While weight gain is a common side effect of some antipsychotics, it can significantly impact a client's health and adherence, and therefore requires medical review by the prescribing psychiatrist, who might adjust the medication or suggest other medical interventions. For example, some antipsychotics have a lower risk of weight gain. Always empower clients to communicate medication-related concerns to their prescribing physician for proper evaluation and management. Question 19. A social worker receives a call from a client's family member expressing concern that the client, who is prescribed an antidepressant, has become increasingly irritable and agitated over the past week. What is the social worker's most appropriate response to the family member? A. Suggest the family member monitor the client's symptoms for a few more days. B. Advise the family member to encourage the client to contact their prescribing physician immediately. C. Inform the family member that these are common side effects and not a cause for concern. D. Share information about alternative non-pharmacological interventions with the family. Answer B. Advise the family member to encourage the client to contact their prescribing physician immediately. This question focuses on the social worker's ethical response to reports of concerning medication side effects from a third party. The phrase, most appropriate response, indicates the necessary protective action. Increased irritability and agitation, especially with antidepressants, can indicate adverse effects, including potential for increased suicidality in some populations, and warrant immediate medical evaluation by the prescribing doctor. For example, in rare cases, antidepressants can paradoxically increase agitation. Always advise family members to direct the client to their prescribing physician when concerning changes in mood or behavior related to medication are observed. Question 20. A client with a history of intravenous drug use, currently in recovery, asks the social worker about starting Suboxone, buprenorphine/naloxone, for opioid use disorder. What is the social worker's best response? A. Explain that Suboxone is an effective medication for opioid use disorder and offer to make a referral to a Suboxone provider. B. Discuss the pros and cons of medication-assisted treatment, MAT, versus abstinence-only approaches. C. Provide the client with information on local support groups for abstinence-based recovery. D. Advise the client that medication for addiction is often replaced with other substances. Answer. A. Explain that Suboxone is an effective medication for opioid use disorder and offer to make a referral to a Suboxone provider. This question assesses the social worker's knowledge and approach to medication-assisted treatment, MAT, for substance use disorders. The keyword best indicates the most supportive and evidence-based approach. Social workers should be knowledgeable about and support evidence-based treatments like Suboxone, which is highly effective for opioid use disorder, and facilitate access to care by offering referrals to qualified prescribers. For instance, explaining that MAT can significantly reduce cravings and overdose risk empowers the client. Always provide accurate information about evidence-based treatments and facilitate appropriate referrals for clients seeking medication for addiction. Question 21. A social worker is assessing a client with chronic pain who expresses frustration with their current pain medication and asks about cannabis for pain management. What is the social worker's most appropriate response? A. Inform the client about the potential legal ramifications of cannabis use. B. Advise the client to discuss all treatment options, including cannabis, with their primary care physician. C. Suggest the client research the benefits of medical cannabis online. D. Educate the client about the potential for cannabis dependence. Answer B. Advise the client to discuss all treatment options, including cannabis, with their primary care physician. This question focuses on the social worker's role in addressing client inquiries about alternative or complementary treatments, particularly those with varying legal and medical statuses. The phrase, most appropriate response, indicates the necessity of a medical referral. While social workers can acknowledge client interest, decisions about any substance for pain management, including cannabis, fall under the purview of a medical doctor who can assess its appropriateness, potential interactions, and legal status in their specific medical context. For example, a doctor can consider existing conditions and other medications. Always direct clients to their medical doctor for advice on using any substance, including cannabis, for medical purposes. Question 22. A client diagnosed with major depressive disorder has been stable on their antidepressant for over a year and expresses a desire to discontinue the medication. What is the social worker's next step? A. Support the client's autonomy and allow them to discontinue the medication. B. Warn the client about the high risk of relapse if they stop taking their medication. C. Encourage the client to consult with their prescribing physician to develop a safe tapering plan. D. Suggest a gradual reduction in dosage over several weeks. Answer: C. Encourage the client to consult with their prescribing physician to develop a safe tapering plan. This question addresses the social worker's role when a client wishes to discontinue psychiatric medication after a period of stability. The keyword next points to the appropriate professional action. Abruptly stopping antidepressants can lead to withdrawal symptoms or relapse, so the social worker must advocate for the client to consult their prescribing physician, who can medically assess readiness and supervise a safe, gradual tapering schedule. For example, a doctor might slowly reduce the dose over several months. Always refer clients to their prescribing doctor for guidance and supervision when they wish to discontinue psychiatric medication. Question 23. A social worker is meeting with a client who is prescribed an opioid for chronic pain. The client reports that their prescription recently ran out, and they are experiencing severe withdrawal symptoms. What is the social worker's immediate action? A. Refer the client to an addiction treatment program. B. Advise the client to contact their pain management physician immediately. C. Discuss strategies for coping with withdrawal symptoms. D. Assist the client in finding emergency housing. Answer: B. Advise the client to contact their pain management physician immediately. This question addresses a critical situation involving medication management and potential withdrawal. The term immediate action highlights the urgency of the situation. Opioid withdrawal can be extremely uncomfortable and, in some cases, dangerous, requiring immediate medical attention. The social worker's role is to ensure the client connects with their medical provider for assessment and management of their symptoms. For example, the doctor might be able to provide guidance on how to manage the acute withdrawal or issue a new prescription. Always prioritize immediate medical consultation for clients experiencing acute and severe medication withdrawal symptoms. Question 24. A social worker learns that a client, who is prescribed medication for psychosis, sometimes shares their medication with a family member who also experiences similar symptoms. What is the social worker's most appropriate action? A. Educate the client about the dangers of sharing prescription medication and its legal implications. B. Refer the family member to a psychiatrist for their own evaluation. C. Explore the client's understanding of their medication and the reasons for sharing it. D. Immediately report the client to their prescribing physician. Answer: C. Explore the client's understanding of their medication and the reasons for sharing it. This question tests the social worker's ability to approach a serious medication misuse issue with a client-centered perspective. The phrase "most appropriate action" means choosing an intervention that promotes understanding before reactive measures. Before educating or reporting, it is crucial to understand the client's rationale for sharing, as it may stem from a misunderstanding, a desire to help, or lack of resources for the family member. For instance, the client might believe they are helping their family member due to a lack of access to care. Always seek to understand the client's perspective and the underlying reasons for their actions when addressing medication misuse. Question 25. During a routine check-in, a social worker notes that a client, who takes an antidepressant, appears significantly more energetic, speaks rapidly, and reports feeling on top of the world after recently having their medication dosage increased. What is the social worker's next step? A. Affirm the client's improved mood and energy levels. B. Encourage the client to continue with their increased dosage as it appears effective. C. Encourage the client to contact their prescribing physician immediately to report these symptoms. D. Schedule a follow-up appointment in 1 week to monitor the client's symptoms. Answer C. Encourage the client to contact their prescribing physician immediately to report these symptoms. This question assesses the social worker's vigilance for potential adverse medication effects, specifically concerning mood stabilizers and antidepressants. The keyword next emphasizes the need for immediate medical consultation. The reported symptoms: increased energy, rapid speech, feeling on top of the world, after an antidepressant dosage increase could indicate a medication-induced hypomanic or manic episode, especially if the client has an undiagnosed bipolar component. For example, some individuals with bipolar disorder can be switched into mania by antidepressants alone. Always advise clients to immediately report any sudden, significant changes in mood or energy following a medication change to their prescribing physician.